Hi, thank you for joining us. We're going to go ahead and get started and talk about the FNP program here at Frontier.
Okay.
So I am Dr. Audra Cave. I am the department chair for the Family Nurse Practitioner Department here at Frontier. I have been with Frontier for about 15 years, and I've worked in many different roles as a faculty member. So I have taught in the courses. I've been clinical faculty, clinical director, and now department chair. So it's my pleasure to be here with you tonight and talk to you about our program. We have some co-presenters with us tonight. Mr. George Duvall is here to help us with clinical advising and to help talk about the clinical program. Do we have a representative from the application to talk about the application process?
I'm
Okay,
not,
so
yeah, I'm not sure if I see anybody.
okay, so we will go through those slides and we'll present that and as to represent them. Um, we have a couple of features for your questions, so please feel free to ask. We have the raise hand feature up at the top if you want to stop and ask some questions. I will pause along the way for questions, and then we have the chat box. So feel free to put your questions in, and we will make sure we get them answered for you. I think the best place to start is really why we're here and the purpose of the F&P department here at Frontier. We are really here to prepare family nurse practitioners to care for families, and we really focus on the rural and the underserved. We offer a structured off-campus, community-based F&P track. And what that really means is that you will do a lot of your coursework in your community at home. We'll talk about this throughout the program of the times when you'll come on campus and join the community for some of our work, and then you'll do your clinicals in your community. So a little bit about frontier and distance education. One of the ways to combat maybe learning and isolation that can sometimes happen with distance education is Frontier has a philosophy of the culture of caring. And what that means is that we come together as a community and caring manners that we respect with respect and dignity. And we draw our students in, and you can expect to find that culture of caring in your actions, not only with your faculty, but with Frontier staff and each other. So you'll see a heavy emphasis on that in our literature and in our coursework. As I said, you're going to be using your community as your classroom so you can study at home. It's flexible to work around your schedule. You will come to our campus in Versailles, Kentucky. We have two trips to campus. One is an orientation, so it's before you begin your coursework. And then there's another one about two-thirds of the way through your program. Right before you start your clinicals, we bring you back for what's called Clinical Bound. And that's a 1 week intensive session where we work on skills and get you ready as ready as you can be to enter into that clinical environment. Some of our achievements, number one is our experience. Frontier has been teaching nurse midwifery and family care for 100 years, and that's a long time. So the distance education model that has become so popular in recent years, Frontier has been doing that for quite some time. We have students and alumni in every state. Our current numbers on this slide here are 2,700 enrolled students. That's a lot of students for a school of nursing. We've got a lot of students. We've been doing it for a long time. And that last bullet point makes me really happy. We have over 10,000 graduates across the country providing care to those patients in rural and underserved and all kinds of settings, taking care of patients in their communities. A little bit more on our achievements. You can see here we have the Higher Education Excellence and Diversity Award. That was awarded in 2024. Frontier has been honored as a great college to work for several years now, um, from 21 all the way through last year, 2025. AACN, or the American Association of Colleges of Nurses, in 2023 awarded Frontier the Inclusive Excellence, Belonging, and Sustainability in Nursing Education Award. And then our Sigma Theta Tau, that's the Honor Society in Nursing in 2024, honored Frontier Nursing University with the Healthy Work Environment Award. We're very proud of those. For the F&P program, some of our achievements, we are the first F&P program in the country, started back in 1970. We recently celebrated our 50th anniversary, probably even our 55th anniversary last year. So in 2020, we marked our 50th anniversary. Our F&P graduates have an overall certification pass rate of 96%. Now, I do have some updated numbers on that. Our pass rate data came in last week for the last year, and our pass rate was 97% for MSN, master's degree, and then 100% for postgraduate certificate. So that would be students who have a certificate as an APRN in another field, and then they come back for the F&P. So we have very strong, robust F&P certification pass rates. Another feather in our cap is our student support services. Frontier is a very student-centered university. Our mission includes is very centered on the student experience and bringing students to their excellence and then transferring that to the care of your patients. So in order to have that, we have to have a robust student support services. And you can see on this slide here some of the different ways that we provide those services. We have advising and faculty connections, academic and clinical support. Our clinical support is fabulous. I can't wait for George to tell you about that. We have accessibility services to help make learning, overcome barriers to learning. We have a wide student community with engagement. There are student interest groups. You can join in any student interest group and be a part of their programming with various different sectors. We have wellness and mental health support. Frontier does offer counseling services to students, military and veteran support, mentoring opportunities where alumni actually mentor our students in some of our programs. We have robust financial aid and scholarships, and really we offer a lifelong network. Many times we hear from our students long after graduation, and we continue to bring everybody into our community so that we can do the most for our communities. So a little bit about those scholarships. I love this slide. In 2025, Frontier awarded $1.7 million in scholarships and stipends to our students. That's phenomenal. We have scholarship cycles every spring and fall. Now, students do need to have a minimum of 24 credits earned from Frontier, and the minimum GPA is 3.25. But there are numerous scholarships, numerous amounts, and they really often come at a very nice time in the curriculum because they help support that clinical practicum. They help support students maybe to back off on some of their work responsibilities so that they can focus on their clinical. So we're very proud of that. All right, I'm going to pass the baton to Mr. George.
Welcome, students. I'm so excited that you're thinking about coming to FNU. And once you get here, you're going to get a team that's going to be activated, including us clinical advisors that are going to follow you through your journey. Our first steps are going to help you try to find preceptors, but we will be working with you, your RCFs, and all the other faculty members. But the great thing about F&U is that you have a whole university behind you to support you in working one-on-one with students and navigating all over the clinical sites and our map, clinical map that hosts almost, I think we're up to almost 20,000 sites to begin to look with to find you preceptors. And we help you troubleshoot along the way. So there's nothing that you can have in your mind that we will not find help and assistance for. So you will be happy to know that you have a team and a whole university behind you to bring support and customer service to F&U vast preceptor network that we provide for you.
And you know what I really like about that side is the customer service piece of it. Um, and because that really is central to how the clinical advising department works with students. It's really about customer support and service to the student, I think.
Dr. Cable, let me follow up with that. That is the most important thing. And when we have our team meetings each week, we reiterate how important we are student centered from the beginning, working student out. So once you come here and your team is activated, you will enjoy all the pleasantries of F&U.
Thank you. Let me pause for just a minute before I describe all of these roles to you and see if there's any questions so far. Okay. So on this slide here, you see the different roles and the different people that might be on that team that George was telling you about. So you've already met me. I'm the department chair for the F&P department, and my role is really just to oversee the department and make sure that we have that focus on excellence, make sure that we have that strategic um, planning so that we can meet the needs not only of our students, but our communities and following those healthcare trends and making sure that we're giving you the best education. So my picture is right up there in the kind of the pink top. Right below me there is Dr. Nancy Pesta-Walsh. She's the clinical director for the F&P department, and she kind of does the same thing that I do. However, her focus is strictly on clinical. So she's ensuring clinical excellence. She's working with students and preceptors in clinical sites and really managing that part. Number three there is course coordinators and course faculty. So when you're taking our courses, you will have a course coordinator who really just manages the overall course. They're like the big umbrella over the course when it comes to management. And then one step below that, you have course faculty. So even within your courses, you're going to have a team of people to help support you through your learning. Number four there, that's regional clinical faculty. We lovingly call those our RCFs. And what they do is they work one-on-one with our students to ensure that they're ready for clinical, to follow them through clinical, to help connect the dots between your didactic learning and your clinical learning, and really facilitate that whole process for you and your preceptor. Number five there is our academic advisors and our clinical advisors. Academic advisors on your team are there to help support you through many, many things. They help support you through what course should I take, your program of study. What if you run into some bumps along the way? Well, your academic advisor is going to be the person to reach out to help you problem solve along the way and also to help cheer you on. Many students meet their academic advisors when they come on campus for orientation, and then they have conversations with their academic advisors, sometimes even a couple of times a term, just to check in, see how things are going. The clinical advisor, like George was telling you, is really focused on that clinical piece of it, all the way from getting you ready to for clinical and meeting or identifying preceptors and sites and using all of the tools that Frontier has to make that happen. Number six, you'll have a financial aid officer in some aspects, and that's really your go-to person for your financial aid, for how do you finance your education, making sure that you understand all of that. And then the seventh person there is a credentialing coordinator, and that person's responsibility is to do a lot of the credentialing and administrative work between Frontier and the clinical sites and the preceptors. So they help work on contracts and they take all of that work off of your plate. And they do it because that doesn't happen at all universities. So we have a department that is dedicated to making sure that all of the I's are dotted and the T's are crossed, and you're ready to go to clinical when you're ready. All right. So the degree options for Frontier. Students come into our program at the MSN level, the master's level, at the postgraduate certificate level, or at the DNP level, the Doctorate of Nursing Practice. In our audience tonight, we're focusing on the MSN and possibly the postgraduate certificate. MSN is a student who does not have a previous APRN degree, and postgraduate certificate is a student that does have a previous post APRN degree. They are coming back, maybe they're a nurse midwife, and they're coming back to become a family nurse practitioner. So the specialties are what we offer here at Frontier for specialties is nurse midwifery, the F&P, women's health nurse practitioner, and psychiatric mental health nurse practitioner. Those are the specialties or the certifications that we prepare you for. So I love this slide. It does a nice job of really walking us through the student journey and what happens from orientation all the way to getting your degree conferred. So you start with what we call Frontier Bound, and that is about a 3-day trip to campus in Versailles, Kentucky, where we kind of get you started. We talk about the systems that you're going to use. You'll be introduced to some of your faculty. You'll get a good deep dive into the curriculum so you'll know what courses you're taking. And then you get to meet a lot of the folks on the student support side. So you'll meet your clinical advisors, you'll meet your advisors, you'll meet IT. Really, just the whole support network is going to come together in that brief period of time, introduce themselves, and tell you what it is that they can do for you, but also tell you how. So the orientation is also a great time for students to network together and get to know each other and really start the process of that culture of caring. It's phenomenal to me sitting on watching Frontier Bound because students come together with such like minds and really make connections and really make lifelong friends. Once you leave Frontier Bound, then you'll start on your online didactic coursework. We do 100% of our didactic coursework online. So that's where you'll do your classes, your pathophysiology, your management classes, things like that. And then once you've finished those, you come back on campus for what we call Clinical Bound. And Clinical Bound is a 1-week intensive experience. You'll come on campus with a smaller group of students who are coming along at the same rate that you are, and you'll dive into the skills that you will need as an F&P. We do some suturing, we do some procedures, we practice physical exam techniques, and we also have a wonderful opportunity to work with standardized patients. So your first office visits with getting into the groove of that will be with standardized patients at Clinical Bound, which is a really nice experience for you because when you go into clinical, some of that mystery of how do I start, where do I even begin, we've already helped lead you through that. Then you'll move into your clinical practicum. We do have a practicum that consists of 750 hours. You'll be in your community, working in the clinics, working with the preceptors, seeing patients, and doing that clinical piece of the work. Once you finish that, you have one more didactic course. It's the comprehensive course where we kind of pull it all together one more time, represent some things, hit the key highlights, and give you the opportunity to test your knowledge before you go to take that certification exam. And then once you have completed that course, then your degree is conferred. You'll have your MSN or your PGC. And once that is completed, then you go to take your certification exam. So I do want to pause on this slide. It covered a lot of information there. Is there anything that I might need to answer or review again? All right, not hearing anything. Some time frame options. I know one of the questions you're thinking for sure is how long is this going to take me and what are my options? Well, Frontier operates on 11-week terms with 2-week breaks between the term. So we have 4 terms in a year. And something that's unique to Frontier is we offer all of our courses every term. So if there's a reshuffling of courses or something that gets us off track, it's easy to get back on track because we offer that same course the next term. For the MSN student, you can plan on somewhere between 2 and 3 years. Depends on your individual situation and the pace that you want to go at, and certainly pacing yourself for success. So generally speaking, 2 to 3 years. For the postgraduate certificate student, that's about a year to a year and a half. The DNP, should you decide to, and your interest is in DNP, then that's generally about 18 months. We also have a rolling admissions process, which means that for you, what that means is that when you apply, you're likely to get an answer relatively quickly, as long as we're within the cycle, because we have rolling admissions. So we accept applications 365 days a year. And that means that that process moves through a little bit more quickly and you get an answer. 4 to 5 weeks. There it is, right on the slide. This slide is going to talk about our admissions criteria and some of the things that you need in order to apply to the program. So first of all, we need an RN, a current active license, unrestricted, a 3.0 cumulative GPA from your highest nursing degree earned. For the MSN, usually we have admissions doing this slide, so I'm thinking through this a little bit.
Uh,
Bachelor's
Audra,
degree in any
oh,
field. Yes.
I was gonna say I'm here to help. My name is
Thank you
Martha.
so
I'm
much.
sorry.
Hi, Martha.
Hi,
Well,
I joined.
let me just hand the baton to you. Thank you, Martha.
Hi, everyone. Good evening. My name is Martha. I'm here on behalf of the admissions team, and I'll go over the admissions criteria with you. For the Master of Science in Nursing program, there is a requirement for the applicant to have an RN that is current and it's active with no encumbrances. They need to have a BSN or a bachelor's degree, and I'll make sure to post the instructions for the portfolio option, but usually a BSN or an ADN with a bachelor's degree in a different field. The GPA must be a 3.0 or above. There is a requirement to have at least 1 year of registered nursing experience, but even without having 1 year of RN experience, there are other options. So I'll make sure to post that as well. That would be for the Master of Science in Nursing. For the postgrad certificate, there is a requirement to have a master's degree with an APRN specialty. For the application itself, it's pretty simple. There's an online application. There is a requirement for a resume and essay. I'll make sure to post those requirements as well. And any nursing degree transcripts will be required as well. FNU will attempt to request those on your behalf first.
Thank you.
You're welcome. And this is for the postgrad certificate admissions criteria is having an APRN degree in one of the specialties listed there.
Thank you.
You're welcome. For the application deadlines, the current application available right now is for summer 2026. The deadline to apply would be April 1st. The course year begins July 6th. The next term would be for fall 2026. That application becomes available on April 2nd. No, there isn't a way to apply earlier. You would have to wait until April 2nd to apply. The deadline to apply for fall would be June 24th, and the course year begins on October 5th, 2026. The current cost per credit hour is $705 for the Family Nurse Practitioner program.
Thank you.
You're welcome.
So let's talk a little bit about the clinical experience. Both MSN and PGC students will need to get 750 clinical hours with a minimum of 16 hours a week in your clinical practicum. For the DNP, that's 500 clinical hours. We also have competencies in our clinical program. So it's not just hours, it's also visit types. So for the F&P program, that being a broad-based primary care program, you'll have X number of adult chronic visits that you need to get, X number of pediatric visits, X number of women's health visits. So once you have satisfied both the clinical competency-based requirements and experiences, and you have the 750 hours, that is when we can say that your clinical experience has been satisfied. And from experience, generally speaking, you get the visit types, the experiences across the lifespan, you get those well before you reach the 750 hours. So, but it is a combination of the two. And here are some pictures of our campus. I'll start at the very top. The picture there of our cafeteria. When you're on campus, we do provide housing and we do provide meals, and we have chef prepared meals. It's a wonderful experience. In that top middle picture, that is the president's house. So it is kind of in the center of campus. And then right beside that is the Welcome Center. That is the first building that you would probably come to because that's where you get all your welcome information. Just below that is our Frontier Nursing University sign. Bottom middle is again our cafeteria. We're so proud of our chef made foods that we put the picture on here twice. And then right beside that, we have kind of a picture of the student dorms in the background. So life as an FNP, I can tell you that it's the best decision that I ever made. I think working with patients and families in the community at that level elevates what you can do to be supportive and to bring healing to individuals, families, and communities. So there's so many things that I could say about life as an FNP. What I really would like to say is that everything that I loved about being an RN was elevated to the next level as an FNP. So you can see our pictures here where we will work across the lifespan with all populations. It's a broad degree. You can do many, many things with it after graduation. You can focus into something specific, or you can stay general with primary care. So it's a wide open field. And I think I just recently read that it's still the most trusted profession, 20 years in a row. So that's another nice thing about nursing. And here's a picture of our faculty there. That's Dr. Tarika Fuller, and she is pinning a student at their graduation, saying that success doesn't come to you, you have to go to it. And should you choose to do that here with Frontier, we have a big team of people that's going to cheer you on and support you along the way. A very active culture. Can I pause for any other questions? We have some email addresses here for you if you want to take a picture of this slide just in case. If you have admissions questions, there's our FNU admissions. Clinical advising is listed here for you, as well as financial aid. Another picture of graduation, the three in the back, I'm in the center. And then there's Dr. Nancy Pesta Walsh and our dear Dr. Diane John. And we're standing around a student as we've just hooded her and congratulated her on her graduation. So we hope that's you. We're ready to do that for you, right? We want to see you on that stage. Okay, so that ends our slides. happy to entertain questions. Many times we tend to have some more questions about clinical and finding preceptors. If anybody would like any more information on that, or admissions.
I had a quick question in
Yes,
regards to
please.
admissions. I do see that the 1 year of RN experience is there, but it says admissions may entertain like certain, like if you're a doula or anything. Are those the only exceptions, or?
I'm going to see if Martha has an answer to that.
Great question. It would be any relevant healthcare experience. So it could, I'll post in the chat some of the options that are acceptable.
Okay.
Okay.
Off the top of your head, do you know if LVN experience is acceptable?
LPN?
Yes.
LPN experience, I believe, isn't one of them.
Okay.
hmm
But you said you'll post the other ones, right?
Correct. Yes.
Okay. Thank you.
You're welcome.
Looks like we have a question in the chat typing. Brianna says she's from California and was curious if you have relations with clinicians here. We have relationships with clinicians across the country. So yes, we do have relationships with preceptors and clinical sites in California. We have quite a few students in California. And so, yes. You're welcome, Brianna. Maisha, your question is, I'm an RN with a BSN. Can I pick preceptors at my hospital? That is an excellent question. Because we are an F&P primary care program, we don't utilize the hospital very much. We primarily do our clinicals out in the outpatient clinics where patients come for primary care. So most of the time, no, the F&P department does not have inpatient clinical opportunities. Now you could utilize a preceptor, like if the preceptor works in the hospital and also in an outpatient clinic, then you could work with that preceptor in their outpatient clinic. Anything to add to that, George?
No, that's perfect, and we will help utilize that and work with the RCF to make sure we find the right person for you.
Absolutely. Brianna, another very good question. Can a preceptor be an MD or a PA? MD is yes. A preceptor can be a physician. You can get 40% of your hours with a physician or a DO. The answer for the PA is a little bit more complicated because that depends on the states. So we have a list of states where we know whether the state will, the state regulations will allow a PA preceptor for an F&P student. So we answer that question on a case-by-case basis, depending on what state you live in or what state you're going to do those clinicals in. Another good question during clinical, do we get rotations in specialty areas? Yes, you can. I think, George, did you just put that in the chat, what the specialty rotations are?
I did. Do you want me to put the hours in there breakdown too, Doc?
Yeah, that'd be great. Thank you so
Okay,
much.
I have it
So
right here.
yes, thank you. You can do 20% of your hours in a specialty rotation. And George has posted where you can see what those specialty rotations are. Off the top of my head, I know some like cardiology, neurology, different things like that. So yes, you can do 20%. Generally speaking, though, we like for that rotation to be your last rotation. We want you to have a good, solid foundation in primary care and then branch out into your specialty. And here, when I was talking about those competencies and the visit types, here's a breakdown for you. So you can see, even though some of those numbers look big, I promise you, 99% of our students get those visits before they get to 750 hours. And your team is going to help you process through that. Is this a site that's going to give me enough visits? That's something that your regional clinical faculty will help you with, and also clinical advising. Great questions. Oh, see some more. Good. Bring them on. Martha has put some specialty site information in there for you. That's what, yeah. So that's where you see we have fast track, we have um, neurology, endocrinology, so many things that you can branch out and experience. Yes, Brianna, you can precept at urgent care. Now, we consider urgent care a specialty, so it's limited to your 20%, that 20% limit. Many, many, many students do urgent care, and it's a fabulous rotation. It really gives you the opportunity to practice those procedures that we learn at Clinical Bound. So yes, definitely, I highly encourage it. Maisha, yes, it is a mandatory 2 trips to campus. That first one is about 3 days, focusing on orientation. That second one is 5 days, focusing on clinical preparedness. And you are welcome to unmute yourself and just ask questions if you would like.
Sorry, I have a little bit more questions about the curriculum, like exactly how many exams, how many do you guys know, like how many essays, like what is the layout? Like do you guys use Canvas?
That's
I
a
came
very
late to the party, sorry.
No, that's fine. Those are great questions. So let me start with the first one. You said kind of the layout of the curriculum. The layout, from sort of a very broad overview, is you'll start off taking core courses. Core courses include things like health promotion, pathophysiology, pharmacology, physical assessment. And each of those courses are laid out the same, but some have more exams than others. So I can tell you, like, pathophysiology is a lot of exams. Health promotion, on the other hand, might include things like reflections and some papers and things like that. Um, we also have simulations in most of our courses, which is really fabulous because you actually get to practice what you're learning in real time. So I would say, in a nutshell, um, most of the courses have exams. I can only think of two that don't include any kind of exam, and that would be health promotion and the roles course. But most of the courses also have a variety of assignments, reflection papers, maybe some papers, sometimes group work, absolutely discussions, um, and then simulation activities. So you get to simulate office visits before you even get to Clinical Bound. We really try to immerse you in the role of an FNP. Does that help, Maisha?
Yes, thank you. That's what I was wondering about the simulation, so I'm glad that you guys have that in your program.
Absolutely, absolutely. And then Brianna had a side note. She submitted her application a few weeks ago. Have they started sending out acceptance letters for summer? I don't know if Martha, if you know the answer to that. Probably,
Yeah.
do they do it before the cutoff?
Yes, some acceptance letters or some replies to applications have been sent out already for summer.
Thank you.
I would definitely, Brianna, if you want to know the status of your application, you can always send a message to fnuadmissions@frontier.edu, and you should be able to get an update on where your application is at in the moment.
Thank you.
You're welcome.
All right. Well, it's been my pleasure to spend some time with you this evening to tell you about our program and extend an invitation for you to apply. Um, I can't say enough good about it. I was a student in the F&P program. It's been a part of my life for a long, long time. It is my pleasure to see students grow and achieve their dreams. And we really work hard to help you get there. So I appreciate your time tonight. I see, Brianna, you were typing, so we don't have to end right now. You can unmute and ask, or you can type your question. That's fine.
No, I'm good. I think
Okay.
there's a bubble there, but I don't
Okay.
have any other questions. Thank you.
You're welcome. Well, I hope you all have a wonderful evening. Thank you, George and Martha, for being here to help co-present. Thank you, Ava, for being in the background and running all of our things so that we look all put together. I appreciate everybody tonight, and I will see you all soon.